Hello everybody, we are here with another episode of Webinar with Experts. Today we're gonna talk with Dr. Irfan Amini, Associate Professor of Urology at Tehran University of Medical Sciences. We are going to talk about urology practice during COVID-19 time.
Good afternoon.
Okay, so let's start with our first question. How have you been in contact with COVID-19 so far? How was your experience as a clinician in regarding to COVID-19?
As a urologist, as you know, I'm working in Imam Khomeini Hospital, that is a university-affiliated hospital, and also it was a referral center for COVID-19 patients especially during the initial weeks of the pandemic. And therefore, all healthcare workers, including urologists and residents of urology, were involved and in close contact with COVID-19 patients. Fortunately, we responded quickly in our department, and we implemented measures to preserve the capacity of the hospital for the COVID-19 patients by canceling all elective surgeries and by decreasing the number of outpatient visits in our clinics. Another good measure that was done by our hospital was the establishment of a telehealth system. Patients were able to join and be consulted via telephone. They were able to upload their documents and receive timely responses. It's not enough, but it was a good step, I think. It is not a good response to all needs of our patients, but it can help them during this outbreak, of course. So from a urology perspective, there was a significant cut down in urological practice, but despite that, urologists and urology residents were highly involved in treatment of the COVID patients, and many hospitals also redeployed urologists and physicians from other specialties to take care of COVID-19 patients, because there was a huge amount of admissions of such patients, and almost all wards in our hospitals was dedicated to patients with COVID-19. So we were involved.
Actually, it was a topic we discussed with our previous guest, Dr. Rashidian, a couple of days ago. He was talking about the redistribution of, specialists in fields other than their own specialty to combat the COVID-19, and it's some type of using your capacity to fight with this virus. How COVID-19 has impacted the urology care itself, the care you can provide to your patients and the routine of your care.
As I mentioned, we canceled all elective surgeries. But the term elective is a little bit difficult to be interpreted. It's not really easy to classify and categorize surgeries into two categories, elective and emergent. There are some other types of surgeries that are not either elective or emergent. I can call them time-sensitive surgeries. For example, you can consider patients with urological malignancies and patients who are suffering from aggressive cancers. These are not emergent. We can postpone surgeries for a little bit, but it's not possible to postpone for a long time. These are time-sensitive. And if, for example, we postpone the surgery of a patient with bladder cancer, especially an aggressive bladder cancer or muscle-invasive bladder cancer, there is a probability of changing a localized disease to a metastatic disease. And that's really harmful and is associated with poor outcomes for the patient. So I believe that this outbreak has impacted our practice and has impacted in a negative way, because definitely some of our patients missed the opportunity to receive timely treatment. We were not able to admit them because it was really dangerous for them. The hospital was not suitable for admission of the patients who are frail and prone to contract the COVID-19 infection with really terrible and unpredictable consequences. And also because of shortage in the resources. we have some problems in admission of these patients. For example, these are really sophisticated surgeries. They usually need ICU beds after the surgery. They need blood transfusion during the surgery. And because of limitation in all these resources, we have to postpone these surgeries. Some of them have been actually in a bad situation because of this delay, but we try to reinitiate our surgeries, especially when we are witnessing a decline in this outbreak.
How did COVID-19 change the medical education in urology so far? I mean, for medical students, for your residents, for your interns, everybody, how they have been impacted by that, their education?
Again, you can consider that in our university and in our hospital, we canceled all elective surgeries. We had a significant and notable cut down in the number of admissions and outpatient visits in the clinics. All these measures have negative impacts on the education of our residents. Also, medical student clinical attachment was completely actually canceled in our department. These are negative impacts of this outbreak on the education in the medicine. But also, I think COVID-19 pandemic was associated with some good points. I think education in the medicine is not limited to learning techniques. There are some other issues that are important. For example, humanitarian approach in the medicine and ethical issues are really important. I think this pandemic was a good opportunity for all of us to practice empathy, morality, and social responsibility. In addition to these issues, I think the shifting into e-learning and online education was another good point associated with this pandemic. I think we should continue that. It was really interesting. It was an awesome experience for both teachers and students, and we should do our best to seize the opportunity to continue this online education, especially in the post-COVID time. I think it has significant impact on the ability in the learning.
Let me ask you about your possible timeline for returning to your routine. Is there any possibility in foreseeable future for you to get back to your routine, and or you think that COVID-19 may have some permanent impacts on your practice for a non-foreseeable future?
Really difficult question to answer. We have just started our practice in urology department. Fortunately, the number of patients who are admitted because of COVID-19 in our hospital has decreased significantly. And only they are limited, and now they are limited into only 2 or 3 buildings. That these buildings are completely separated from the remaining parts of the hospital, including our wards. So we started our practice in our department in the urology ward, but we are still worried about the reinitiation of the outbreak and a second peak of the outbreak. We should not be careless in this issue. I hope that does not happen, but we cannot be sure about that. Therefore, we decided to be really careful. For example, we categorized our surgeries into 4 groups. Emergent surgeries that we had to do at any time, at any situation, and highly time-sensitive surgeries. These surgeries are also being done in our department right now. And for relatively time-sensitive surgeries, we decide case by case after discussing with senior faculty members and other colleagues, including anesthesiology team, and decide about them. But for completely elective surgeries that are not time-sensitive and can be postponed for months or even 6 months, we have not started those type of surgeries.
So you have used the different measures to adapt with this new situation in COVID-19.
Institutional-based guideline, and according to that guideline, we decide which patients might benefit from the surgery in this tough situation.
Okay, Dr. Amini, thanks for your time. I'm trying to reactivate the comment section. Some of our audiences asked about the need for referral to a hospital. As you know, people are afraid of getting COVID-19, but they are not sure if they should refer to your hospital for urology care. It's a question of them that in which situation they should refer despite the danger of COVID-19, and in which situation they can keep it for some time and then wait for some more or less dangerous situation when the COVID-19 suppressed.
I think the situation is almost controlled right now, especially in Imam Khomeini Hospital. They are implementing really serious measures to prevent spreading of the disease. For example, at the time of entrance into the clinics, all the people are screened, are checked, and the temperature is checked. Therefore, they shouldn't be worried about it. But it's not really necessary to participate in the outpatient clinics if they are not suffering from a serious issue. For example, if something is very light and can be handled telehealth systems or actually telephone conversations, it's better for them to do this and not participate in outpatient clinic. But there is a problem for our cancer patients. Actually, we have missed many of them because of the fear and anxiety of COVID-19. The patients avoid participating in outpatient clinics, and it has a serious impact on their follow-up. As you know, follow-up visits is really important for cancer patients. Therefore, for those who are suffering from serious disorders, I do not recommend to be afraid of presenting in outpatient clinics and hospitals, because everything is now safe and we take care of them for sure.
And have you been able to share your experience with our regional neighbors, other countries, or have been they eager to get some tips from you about the care? Because I know you have some experience in disseminating the information about the care, and I'm curious if some of our audiences were curious if we could share our knowledge with our regional neighbors.
As you know, urology is not a field that is seriously involved in this pandemic. But as my other colleagues in my hospital, for example, specialists in the infectious disease or anesthesiology or pulmonologist or other specialties that are highly involved with treatment of the COVID patients, participate in different webinars and organize even the webinars for region and even in the world. So they are highly active in this issue, I'm sure about it.
Dr. Amini, thank you so much, and bye for now.
Bye.